Welcome everyone to our presentation. We're going to be talking about our paper, When is ML Data Good? Valuing in Public Health Datafication. My name is Divy. I'm part of the Google Research India Lab. And my co-presenter here today is Azra Ismail, who's the joint first author on this paper from Georgia Tech. Our collaborators are Pratyush Kumar at IIT Madras, Hanna, formerly at Google Research, Nithya Sambasivan, formerly at Google Research, and Neha Kumar at Georgia Tech. In recent years, there has been an increasing interest in data work, the people who work with these data sets, the process of working with the data, especially for machine learning systems. Notably, recent work around the impact of data cascades in machine learning datasets has also sparked the interest from the topmost machine learning conference, NeurIPS, to the creation of a datasets track. Amidst this discussion on work, models developed using datasets are used in high-stakes domains such as public health, public welfare, and so on and so forth. Datasets in public health specifically are developed through processes embedded in complex societal and organizational factors. Datafication is composed of many actors who are often interdependent and influence data work for other stakeholders, but are not aware of these interdependencies. However, there are frequent tensions in data quality where machine learning developers are unhappy with the data quality that they receive, whereas data collectors feel the high pressure and burden of data collection activities. Whereas prior work has reported on the challenges faced by health workers and data annotators, there's very little understanding of context where multiple actors work on the same data as data goes from field to function. Our research questions were motivated by this context, where we wanted to understand what are the interdependencies of data work through the supply chain of its production, where a single dataset is acted on by multiple stakeholders. Similarly, what are the values and priorities of different data workers who participate in this supply chain? And lastly, how can we make the labor involved in data work more visible? Our research provides a deepened understanding of this disconnect in valuing by investigating the perspectives of multiple stakeholders or data workers as data are collected from field frontline health workers or data collectors and passed on to data stewards who prepare them for machine learning developers, putting them into use in ML models for the communities where the data was collected from. Our research insights seek to advance scholarship towards understanding valuing behaviors and practices in data work, paving the way for greater transparency and accountability in the overall machine learning development process.
Here we have a visual representation of the flow of data in this particular context for public health. So a quick overview of the process. The data collectors in this context were actually frontline health workers who routinely collect data from community members and then pass it on to data stewards, which includes data entry operators and project officers who digitize and analyze data. These data sets are further used by ML developers and researchers to develop ML models that potentially impact the communities that they hope to serve. The study that we undertook entailed 46 semi-structured interviews with various stakeholders as part of this data supply chain. So this included 23 data collectors or frontline health workers, 13 data stewards, and 10 ML developers. The interviews lasted 30 to 60 minutes, and the various stakeholders came from different domains in public health, including maternal health, sexual health, preventative care, health outreach, and more. And we also had ML developers who were located outside India in Singapore and the United States. The languages that we conducted the interviews in included English, Hindi, and Kannada. Our work contributes to a body of literature that has emerged recently around the generation of data sets for ML models and understandings of data work in ML and data science. We also connect with a lot of empirical research on data work performed in the space of public health. And we also draw on the field of valuation studies from a theoretical perspective to understand how data work is valued and how data are valued at different stages of the data supply chain in our context.
All right. I'm going to walk us through the findings, and we're going to be organizing our findings by understanding the challenges that machine learning developers face and go downstream from there. Talking about machine learning developers specifically, our interviews with them revealed that they spend a substantial amount of time making data good for developing ML models, and that was the core value proposition for them. Their perceptions of what entails a good data set for machine learning resulted in several operations on the data to make them fit for purpose. They faced several challenges along the way because they were working with self-reported noisy data, missing data fields, near perfect entries, and so on and so forth. Developers faced additional challenges in contextualizing their operations in data because they lacked context about how the data was collected and how it was structurally planned while it was collected. Similarly, they relied on field partners and domain experts for low labeling and ground truth reporting mechanisms, which were not always easily accessible to them. The data stewards we interviewed performed a range of operations on data collected by data collectors through paper forms, daily diaries, and notebooks. These operations included data entry, processing, and analysis. However, they frequently faced tensions through issues in quality of the data collected by the collectors and burdened with the lack of influence and communication channels to actually affect change over this quality. The data collected over here was through frontline health workers, who are the data collectors in this stage, who performed data collection alongside their primary role of healthcare outreach. We found that organizational structures and the local context shaped data collection by data collectors and their valuing of the data. Good data reflected performance on healthcare tasks and emphasized presentation and completeness, not quality. Data collectors received varied incentives for an array of data collection tasks, but received very little feedback on their work and little information about the use of their data for their own communities. They built strong relations in their community, which actually enabled and furthered data collection in the first place, especially of sensitive health data. But many societal and cultural factors limited their access to certain communities.
Next, I will talk about the implications and takeaways for future work in this space. Our analysis reflected several conflicts in valuing across the stakeholders. So, for instance, we saw that the ML developers perceived certain data quality issues with the data that was handed to them. But these were a result of organizational, social, and cultural ecologies of the data collector in terms of the data that they were expected to collect, in terms of the conflicts that they had with their everyday workflows, and the kinds of data that they were able to access in the field. The ML developers also created the models far from the context where training data was collected and aggregated. And this meant that they frequently lacked context on why certain data fields were missing. Data was also valued differently based on organizational structures and incentives. So, for instance, for the ML developers, their interest was in creating novel data models, while the health workers were more interested in making sure that they got monetary incentives for performing certain tasks. First, we recommend creating a shared understanding of the taxonomy of good data across stakeholders. In this particular context of public health, each stakeholder had a different understanding of what entailed good data depending on their own individual responsibilities. And there's a need for a common language across these various stakeholders. We also need to attend to where and on whom the burden of creating this transparency lies. There's also a need for greater accountability towards the communities for whom these ML models are being generated. So frequently, the communities were unaware of how the data was being used, and there was a lack of accountability towards the on the performance of these models for supporting these communities. And one way to address this could be by creating shared accountability for ML outcomes between ML developers and organizations providing data to help streamline workflows across different stakeholders.